Thank you, Madam Chair, and I want to thank all our witnesses, including Ms. Zarecki, for being here today. I can't imagine the pain and grief that you had to endure since losing Scarlett, but I thank you for your courage and for sharing her story with us, really. This cause has long been something that I support. In 2014, President Obama signed into law the Sudden Unexpected Death Data Enhancement and Awareness Act, a law that I sponsored that required the Secretary to collect info on sudden unexpected infant death and sudden unexplained death in childhood and educate the public and collaborate with other agencies and state and local health departments to provide information for medical examiners and other individuals. And thanks to this law, we now have a more clear vision of what is known and unknown about sudden unexpected infant death and sudden unexpected death in childhood. And our focus has to turn now, how can we take further action to prevent these tragedies and support families, care providers, and researchers when these tragedies occur. One of the provisions of the Scarlet Sunshine Act would provide grants for support services for families who have had a child die, including grief counseling, home visits, and support groups. So I wanted to ask you, Ms. Zarecki, no amount of support can ever replace what you or your families have lost, but can you tell us how support services can be helpful to families like yours in working through these tragedies?
Thank you so much for your question, and thank you for asking it, because it actually gives me the opportunity to focus on one of the strengths of the House bill, and that, of course, is those support services. I think when you've lost a child, there's a before and there's an after. And once you've crossed that line, oftentimes there's no greater gift than being able to connect with another family who really truly understands. And it's the support services that we have received through national foundations as well as local foundations in Pittsburgh. It has been absolutely critical in being able to live life after our loss. So, bereavement support for families, of course, is very critical. It's very badly needed, and I truly don't know where I would be today if I didn't have the support of other families who have walked this journey before me. And I thank you, Congressman, for your leadership on this issue and for working on it for many years.
Well, thank you. Let me just turn to Dr. Beers from a physician's point of view. In your testimony, Doctor, you discussed the difficulty your team faced when you could not identify timely and accessible grief counseling for a family who had just lost a child. As a physician, can you tell us about the appropriate forms of grief counseling and other support services that should be made available to families, and how these services can help support the mental and emotional health of a family?
Absolutely, and I think, as you and other members know, access to timely and accessible mental health services is a significant issue across the country, and so and grief counseling and grief services are particularly important for families when you need them. You need them immediately. They're not services that you can wait 6, 8, 10 months for. You need mental health providers who are specifically trained in addressing grief and bereavement issues. And what type of services is going to vary a little bit depending on the family and their individual desires and needs. For some, individual therapy may be appropriate, and for others, group therapy and support groups may be appropriate as well. But certainly we should make sure that both of those things are available to families.
Thank you. I wanted to issue one more question in the time remaining. Another important provision of the bill supports grants for infants' safe sleep and efforts to decrease risk factors. You mentioned physicians began recommending positioning babies on their back for sleep starting in the 1990s. I remember that. And after which we saw a decrease in cases of sudden unexpected infant death. However, as continued tragedies demonstrate, we still have a lot of work to do. So in your testimony, you suggested that we might need to reframe safe sleep recommendations to address cultural or socioeconomic considerations. Can you explain what that means, and how can we ensure that all families receive the benefit of these recommendations.
No, absolutely. And perhaps the best way is to share a short example. I am close colleagues with a pediatrician and researcher who does a lot of research in this area, and we were used to work together in Washington, D.C., and working with many low-income families who live in neighborhoods with high community violence. And one of the things they learned through their qualitative research was that many of the families they talked to were not adhering to the safe sleep recommendations because they were fearful of people entering into their house or apartment and wanted their baby very close to them. And they felt like putting their baby in a crib was taking them too far away and was putting them at risk because they were living in unsafe and unstable housing. And so being able to tailor those recommendations to address those very specific concerns of bringing the crib very close to the bed, making sure that you were set up and your room was set up so that the crib was away from the door, those things made an enormous difference. But the only way we knew that was by asking those questions and really diving into what a family's specific concerns were.
Thank you. Thank you, Madam Chair.